What is telemedicine? Telemedicine is the use of medical information exchanged from one site to another via electronic communications to improve a patient's clinical health. Telemedicine is medical care and education at a distance. Telemedicine will improve the health of individuals. Self-care, health promotion, prevention, and education is enhanced by telemedicine. Expanding telemedicine services will improve the health status of homebound individuals. Telemedicine will promote health improvements in rural and underserved areas. You may ask yourself, how does telemedicine benefit healthcare? Telemedicine will improve accessibility, quality, and affordability. Telemedicine has a positive impact on multiple perspectives of healthcare, such as the patient, provider, payers, and care facilities. Telemedicine will have an effect on the healthcare system. It enables access to healthcare services when there is a decreasing supply of healthcare providers and an increasing number of patients. Healthcare costs are reduced due to timelier access to the right specialists, which reduces the risk of readmissions, misdiagnosis, and inefficiencies in the healthcare system. From a patient perspective, patients may have better results due to timely access to providers who specialize in their specific needs. There's remote access to consultations with specialists, so patient-physician relationships will be reinforced due to at-home monitoring processes. There's also a decrease in unnecessary facility transfers. Patients may avoid transfers to different facilities in order to receive specialty services. Providers can determine the best care option for patients during the consultation process, which may allow patients to stay local or remain closer to home. From a physician perspective, physicians can now expand their practice to reach individuals outside of their local area without the traveling expense. There is an extension of clinical service to patients who will benefit from their specialty research and clinical studies. There is an increased productivity due to the time saved from traveling to different facilities. It generates more revenue due to additional care of new patients. And it retains patients who may live in different states or countries, which will also increase revenue. From a care facility's perspective, telemedicine will improve relationships with facilities in underserved communities. Teleconsulting will allow physicians to determine the level of patient care needed, and care facilities can determine if they have the means to do so. This will increase revenue for the facility as well. Bed utilization will be optimized by the care facility and minimize the risk of deviation due to the specialist being able to treat through the use of telemedicine. From a payer's perspective, costs are reduced and resources are used more efficiently to tackle patient conditions. Access to the right specialists eliminates readmissions. It reduces length of stay. And timely access to specialty providers reduces risks of unfavorable events. State licensing restrictions have limited the efficiency of telemedicine. State licensures have created challenges for physicians who want to practice or provide telemedicine services outside of their own state. Providers would need to obtain a licensure for every state that their patients live in. How to solve licensing restrictions. A special limited license to practice telemedicine in surrounding states, or reciprocal licensing, would allow states to recognize the medical licenses of other states. A lack of standards of care in telemedicine can translate into legal risks. The Federation of State Medical Boards and American Medical Association have developed guidelines in order to decrease legal risk for healthcare providers practicing telemedicine. Guidelines from the Federation of State Medical Boards state that telemedicine providers must establish a credible patient-physician relationship They can do this by fully authenticating the location and identifying requesting patients. The provider must validate identity and credentials. And they can also obtain appropriate consent from patients, which includes special informed consent regarding treatments and limitations of telemedicine. Guidelines according to the American Medical Association state that physicians must establish a valid patient-physician relationship, which includes one face-to-face examination. Also, physicians delivering telemedicine must be licensed in the state which the patient is receiving services. The technology being used includes networking, telecommunications, multimedia collaboration, devices and sensors, healthcare information technology, and consultations are generally recorded and added to a patient's records. Telehealth devices can be connected to video conferencing endpoints, such as the otoscope for the ear, dermoscope for the skin, electronic stethoscope for the bowel, lungs, and heart. They can also be equipped with standard video outputs, such as ultrasound, ocular imaging equipment, and an endoscope. And they are also network-enabled monitoring devices, such as the ECG, EEG, EMG, vital signs monitors, glucometers, scales, and spirometers. Some services offered by telemedicine include telepsychiatry, teledermatology, telecardiology, teleanesthesia, teleradiology, telepathology, e-health, such as virtual appointments, personal health records, and home health monitoring. Overall benefits include it allows communication and data exchange without having to be face-to-face. It improves information quality and educational aspects while keeping patient safety a major priority. It removes time constraints and location issues. And it allows a scenario-specific provider selection. There will be a decrease in the degree of effort needed to obtain care. Patient benefits include reducing needs to travel, removes opportunity costs, increases routine visits by removing the hurdles revolving around distance and time, and improved access increases consumer satisfaction. Provider benefits include being able to work from office provides convenience. It decreases costs, cuts down workload, extends services to a more diverse population, and readily receives education on evidence-based practices. There will be cost benefits. They are measured by goals to support health, reduce disease, disability, and abstain from pain and suffrage. Telemedicine may not bring in revenue, and in theory, this aids in controlling consumer costs. Cost containment due to triaging illness severity to cross-appropriate solutions. There's a reduction in hospital stays, and it mitigates travel expenses for patient and the provider. Quality benefits include and are determined by organization timeliness and specialization. There's a reduction of unnecessary exams. There's a centrality to the care the patient needs. And there's an increase in care team collaboration. Worries brought about by the use of telemedicine include there may not be able to keep up with patient expectations. Removal of barriers will increase volume of patients seeking services, and if prices don't decline, people will be paying more. Patient apprehensions in participating in telemedicine. Providers will fall behind on technical advances, and maintaining professional standards when diagnosing, treating, and following up with patients. Building off the technology, HIT is working on making hard endpoint and soft endpoint video conferencing calls compatible. With rapid growth of telemedicine, HIT needs to work on standardization and also identifying barriers with users and working to correct them. Patient involvement will include online support groups, self-managing, electronic health records, at-home monitoring, video calls with providers, and mobile apps. We can deliver HIT through the telemedicine solution through different types of services and tools. As you can see, telemedicine is offered in a variety of applications. There are many applications involving telemedicine. There are many connections, as you can see, in telemedicine. A few telemedicine facts. Medicare has been slower to change reimbursement policies to accommodate telemedicine care. Private insurers and state Medicaid payers have been more progressive in covering many services, and that's pushing more doctors and hospitals to provide them. Telehealth can be used interchangeably with telemedicine. Under certain circumstances, it can translate to additional revenue, enhanced care management, and flexibility in when services are offered. Mature electronic health records and clinical decision support systems lead causes that interest healthcare industry leaders to want to pursue telemedicine as a driver in health information technology. By meeting proper standards and being compatible with other devices, these equipment allows for quality images and accurate patient data to be obtained. Users of telemedicine include public and private healthcare consumers, Medicare recipients, certain insurance users, doctors, patients, and other types of healthcare professionals. When acquiring telemedicine, managers must understand costs and decide what the facility actually needs. It must assign hypothetical employee placement towards equipment, inquire about future patient involvement, determine time devoted to telemedicine, make sure telemedicine equipment is compatible with facility equipment, determine hardware-software capabilities, introduce employees to new equipment, understand monitors, computers, microphones, video cameras, and all other devices associated with the technology. Be sure equipment meets proper certifications. Understand terms and conditions along with the manufacturer warranty support system. Become confident and familiar with equipment and make sure all users are as well. Telemedicine will have a positive impact on the patient. Telemedicine will allow for access to a physician or healthcare provider at a distant facility, specialized consultations, monitoring vital signs and lab data, transmission of diagnostic tests, faster transfer time to a specialized facility, continuity of care, and continuing education for the patient. Some people are located in an area where there is a shortage of healthcare professionals. The U.S. Department of Health and Human Resources has set parameters deeming an area as a health professional shortage area. These parameters include 3,500 or more people per primary care physician, 5,000 or more people per dentist, 30,000 more people per psychiatrist. With telemedicine, access to a physician or a healthcare provider is permissible via teleconferencing. This will allow for distant assessment, viewing of test results, communication with other facilities' physicians, and determination of an interventional course. If needed, transfer time to a skilled facility is optimized due to enhanced assessment and multi-facility communication.